Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. We are talking about breast reconstruction with Dr. Edward Park, a board-certified plastic surgeon with both the American Board of Plastic Surgery and the American Society of Plastic Surgery. Dr. Park is passionate about cosmetic, plastic, and reconstructive surgery and has a specialized interest in facial aesthetic surgery, breast and body contouring surgery, and minimally invasive procedures. In this episode, let's listen as Dr. Park talks candidly about breast reconstruction and shares what you need to know to decide if this procedure is right for you. Hey, I'm Amy, and we are live in the studio today with Dr. Park, who is going to give us some insight on breast reconstruction surgery. How are you today?
Very good, Amy. Thanks.
All right, so we want to learn a little bit about you before we get into the meat and potatoes here. So if you couldn't be a plastic surgeon, what would you be?
Wow. I would like to be a Formula One race car driver.
Really?
Like the speed.
Okay, you've got the need for speed.
The need for speed.
All right, what about the best piece of advice you've ever received?
I would say to try. I would
Try.
like my kids to try in everything they do.
Okay, I like that. What is your favorite food?
Kimchi.
He didn't even have to think about it. Kimchi.
That's my background. I could eat kimchi with pizza.
With pizza?
Yeah, I sure can.
Oh, I've never heard of such a thing. Okay, I'll try it. Who is someone you admire and why?
I admire my mother and father because they've instilled in me very good discipline through my father and the balance of my mother, who has been really loving, caring, and sweet.
Oh, wonderful.
So,
What's your
Hi, Mom.
favorite? Hey, Mom. What's your favorite thing to do on your day off?
I really like to spend time with my kids, my four beautiful kids, and I love to take them out on the golf course.
Okay.
Somewhere peaceful.
Nice. All right. You said 4.
Four.
How old are they?
They are 13, 9, 7, and 5. I had to think about that, but
That's
yeah.
all right. Do they all have their own set of golf clubs?
They do.
Uh-oh.
They all are swinging away. My 5-year-old daughter's going at it.
I love it. That's
Yeah.
incredible. What is one thing in your life other than kimchi and your family that you could not live without?
I couldn't live without my loving wife.
Uh-huh.
Did we say that we can answer that? Or
Yes, you can say that.
she's really the rock and solid support system. And of course, my 4 beautiful children. I love my work. I really couldn't live without working. I really enjoy doing plastic and reconstructive surgery.
Awesome. Have you had the time to binge watch anything lately?
We really like to watch as a family This Is Us.
Oh, my favorite.
Very, very emotional and good values.
Awesome.
Yeah.
What would you say is the most rewarding part about your job?
Really, it's just listening to the patients and watching their transformation. And it could be everything from a simple eyelid lift to breast surgery, all the way up to breast cancer reconstruction, where people are struggling to overcome cancer.
Yeah, gosh, I can only imagine. Well, let's kind of dive right into that. So tell us a little bit about what breast reconstruction surgery is.
So breast reconstruction is a large part of my practice. I trained at Stanford for a 6-year residency, and we did a lot of breast cancer reconstruction. And so I have the privilege and really the honor to continue to do breast cancer reconstruction in my practice.
Okay.
So when a woman is diagnosed with breast cancer, essentially they're seeing a triumvirate of 3 doctors. They're going to see a general surgeon, an oncologist, and myself as a reconstructive surgeon. And I'd like to consider myself just as equally important in terms of restoring what's going to be taken away from them.
Right.
And it's a really difficult thing for them to undergo a mastectomy, which is removal of the breast in order to treat the cancer. So my role is to coordinate with the general surgeon and to work with them on the same day of surgery as the removal to reconstruct the breast.
I was going to ask you, so does the patient come and see you before the surgery and
Ye-
you evaluate their current situation before they do?
It's a little bit of a shame, Amy, because oftentimes I'm seeing them a little bit on the tail end.
Okay.
And a lot of the times the patients aren't able to see me
Mm-hmm.
and they will undergo a simple lumpectomy radiation without my opinion involved. But when I do get the good fortune to really evaluate them, then we can talk about restoring and reconstructing them back to whole.
So you said you are there on the day that they're having the mastectomy?
Correct.
So you're reconstructing at the same time.
So that's essentially what's called an immediate breast reconstruction. So
Okay.
that's really the best choice. And I have a good relationship with my general surgeon in terms of our offices being able to coordinate our surgeries on the same day so that the patient
Wow.
can have it done all in one sitting.
I was going to say that's amazing too because you don't really want to recover from 2 surgeries. You might as well get it
Exactly.
done at once if you can.
Exactly, yes.
Okay, so you kind of touched on this, but who would be a good candidate for this then?
Generally, anyone that's been diagnosed with breast cancer, I would love to meet that patient. And sometimes I'll get phone calls from family members or other patients of patients just to get my advice. And my role is to just basically give them reconstructive options.
Okay. Is this procedure typically covered by insurance?
Yes, fortunately, the breast cancer patients are covered by insurance. I would say the majority.
Okay.
There are some times, very rare times, where a patient may not have insurance or whatnot. As a matter of fact, tomorrow my associate is involved with what's called a mission plastic surgery, and then sometimes we'll do pro bono work for them as well.
Oh, that's got to be incredibly rewarding for you.
Yeah.
Wonderful. What could the patient kind of expect during a consultation with you? Because they will have a consultation with you before surgery, correct?
Correct. So when I have the good fortune to meet a breast cancer patient, it really is an emotional consultation.
I bet.
And oftentimes I just have to listen to their story. But the good news is, despite the rampant breast cancer, I think it's about 1 in 7 women in the United States that suffer from
Crazy.
breast cancer. But the good news is a lot of them go on to recover from it and lead a long, healthy life. So that's really important.
That's great. Are there any questions that the patient should have prepared for you on consultation day?
I think it's a very long day on that consultation because there's so much that they're going through inside emotionally. They have to deal with the mastectomy as well as the reconstruction I'm doing, and then oftentimes chemo and radiation afterwards. So they're getting a lot of inundation with information. So although I'm giving them the reconstructive options, I tell them that really you and I are going on a journey, and this is going to take some time to go over. So there's actually multiple consultations generally when we're dealing with breast cancer reconstruction.
Okay. Just like anything else, I'm assuming, are there risks and complications that are possible?
Absolutely. We are dealing with a little bit more complicated surgeries when we're dealing with reconstruction. There are essentially 2 ways to reconstruct the breast, and oftentimes you hear about tissue expanders and implants. That's one way.
Okay.
And then the second way is when we're moving tissue around, and that's true reconstruction of muscle flaps and skin flaps to move from one part of the body to the other in order to recreate that breast. And so when we're doing more of those second complicated surgeries, we have to deal with flap viability, if that flap's going to survive, and things of that nature. So the risks are a little bit higher in those types of surgery.
Okay. I know the patient at this time is obviously going through so much, as you said. Is there anything that they can do kind of at home to prepare themselves for this massive surgery?
I think the most important in these patients, Amy, is really about emotional support. There's just a lot going on with these patients, and it's not so much of what I'm going to do for them from a reconstructive option.
Right.
But I have a list of patients on the very first consult of my own patients that have survived breast cancer reconstruction, and they all give their phone numbers and give them the
Oh, it's
moral
wonderful.
support. So I think if you have built a very strong moral and emotional support system, whether it's family and friends, that's going to be really, really important for them.
Absolutely. So can you tell us how the procedure is performed? I know you said it goes one of 2 ways, but can you kind of just explain each one?
I would say that the most common way is tissue expanders and then implant reconstruction.
Okay.
So once I coordinate with the general surgeon on the day of surgery, I'll be doing the markings, and once he's completed the mastectomy, on the one side of the breast, he will often move on to the other side, and I'll start to work on that first side.
Okay.
And what I'm doing is really a variation of cosmetic breast augmentation, but I am putting a tissue expander underneath the muscle and then closing the skin above it. A tissue expander is a device where we can fill the device with saline and slowly enlarge it over weeks in order to expand the breast skin and tissue back to the size that they wish to be.
Wow. Interesting.
Yeah.
So much, so much to learn.
Yeah.
So what can they expect to experience during recovery? What is the recovery time, pain level, all of it?
So pain level is not too different from any other type of surgery when we're doing breast surgery, but they do want to take about 1 or 2 weeks off work.
Okay.
Breast reconstruction, even in my initial consultation, I tell them this is going to be about a 1-year journey.
Okay.
Because there are several steps going on. Not only do we have to reconstruct the breast, we also have to reconstruct the nipple and areolar complex. Sometimes we have to do a contralateral breast symmetry surgery. So we oftentimes have to do 2, sometimes 4 surgeries in a 1-year span.
Wow.
So we want to prepare them for this journey.
Do they have follow-up visits? Do they come back often or?
Absolutely. And in a tissue expander situation, I'm expanding in my office with no pain, the tissue expander every 2 to 3 weeks.
Okay. What results can the patient expect to experience over time?
What I like to tell them in terms of the positivity of this is you're going to be a survivor. Generally, they do very, very well with the treatments out there. And we want to get you to be restored to your whole self and even look maybe better.
Right.
Maybe they needed a lift, and that's going to be incorporated in their breast reconstruction. But we want to restore you back to wholeness and looking good.
Gotcha. Gosh, thank you, Dr. Park, so much for your insight. An incredible thing that you're doing there, and we definitely appreciate it. And I'm sure there's lots of ladies out there listening that wanted all that insight, so thank you. It sounds to me like you have just devoted so much time and energy to this cause. Tell me why.
The breast cancer patients that I meet, each and every one of them is like a hero to me. They inspire me, and they really give me the reason. I consider what I'm doing for them a privilege and a gift to give back to them and restore them back to wholeness. And I learn a lot from my own patients, and I really learn the most from breast cancer patients. I don't think I myself could even envision overcoming cancer, and these are real people that are beating it, surviving it, and then moving on to bigger and better things in life.
Well, we appreciate you. Keep doing what you're doing. You are changing lives every day.
Thank you.
All the healthcare experts featured recommend and accept the CareCredit credit card. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Freena with CareCredit, and I will see you soon.